Okay, thanks for joining the November 5th meeting of the Citizen Oversight Board. It's been a busy week for the city of Denver with elections, and thank you to the voters of the city for helping to pass 2G, which gives this board more authority in the hiring process. We are also transitioning from Al Gardner to myself as chair of the board. Just want to say thank you to Al for all of your help in carrying us through a very busy cycle of leadership and a huge amount of activity for the board. So, you know, endlessly thankful for your role in supporting the board and for getting us organized and for working on the hiring process and everything else that you have done. And we're also thrilled that you're staying on the board. So continue to be excited about your leadership and contribution. Also, congratulations to Dr. April Alexander, who is now our board vice chair. The board voted over email to elect her as the vice chair this past week. And we are thrilled to have you in the executive leadership of the board. We know that you'll make a huge contribution in that role. So thank you and congratulations. One more note based on sort of where we are with 2G. I am meeting with city HR and the recruiter and the CAO today to kind of talk about where the process is and where we go from here now that 2G has passed. So in our next meeting, I'll be able to update the board on where that all is. I don't yet know sort of how that'll all work, but I'm working on getting that information now. So more to come on that. With that, I think we can turn over to our regular agenda. Welcome to our participants in today's meeting. We've got some interesting topics to cover with Sheriff Diggins and Dr. Nikki Johnson from the DSD Mental Health Services. We also hope to hear from a community member, Janet Robertson, about an experience with her son in one of the DSD facilities. So with that, Daniel, are there any action items or activities you want to cover from our previous meetings?
I think not a whole lot, but we do have finalized the agenda for the quarterly public forum next Tuesday evening. So that is just an update that was completed. We have started recording videos of these meetings, created a YouTube account for the board where they will live. And I was able to get the automatically generated subtitles attached to that. So they should be in an accessible format. And then we also have the booking process for attending the NACO conference is going well. I have gotten city credit cards for travel and purchasing that I'm working through that process of using for the first time. So that update is going well also. Finally, in between last meeting and this meeting, you did check off the meeting with the Department of Public Safety about the 112 board's feedback on the 112 recommendations from the task force to reimagine policing and public safety, at least those recommendations that relate to the board more directly. And that was an action item from last meeting as well.
Great, and just one follow-up related to that. I am beginning to get some meetings on the calendar for COB to connect with members of the Reimagining Task Force, just so we can connect the dots on our questions and areas of inquiry on recommendations. So more to come on that, but looking to re-engage there. So that's exciting as well. Next item should be passing the minutes from our previous meeting. So If folks have had a chance to read that and review, Daniel's very thorough. Thank you. Meeting minutes. It helps to have a pro do that. Not that Stefan and I didn't do a good job, but it is it is nice to have your contribution there. So thank you. Can I get a motion to approve those or make suggestions for changes?
So moved.
All in favor? Aye.
Aye.
Great. Any opposed? Perfect. Okay, so the motion passes. All
Credit where
right.
credit's due. Stefan has still been helping review them prior to the full board's review. So.
Okay, great. Well, with
All
that, thank you to both of you. We'll turn it over to Sheriff Diggins, who was here but is not here now.
Can you not see me?
Oh, there you are. Sorry. I have
Not sure we
Fine.
want to see you.
okay.
I
Awesome.
can't get you, sir.
All right, Sheriff, we'll turn it over to you.
Well, thank you. Good morning, everyone. It's great to see everybody, and certainly appreciate the opportunity to meet with you all again this quarter. I've also have present Dr. Nikki Johnson, who is our Chief of Mental Health Services and who has been working with us since January of this year and has really done a tremendous job. I'll say beyond tremendous, a phenomenal job in overseeing all mental health services for our department. I received a list of 6 questions that I'm prepared to respond to this morning, and also will respond after Mrs. Robertson presents this morning. And wasn't sure if you all wanted me to just go down the list and stop and allow some questions, or if you just wanted me to read right through them and have questions afterwards. So is there a preference for the board?
I think we'll probably ask questions as we go along.
Okay.
That works for board members and if they have them. Otherwise, just, move to the next question if there aren't discussion topics from the board members.
Okay, sounds good. And
Thank you.
because I know this is a public meeting, I'll read each question before I respond. Question number 1, on September 4th, 2020, Sheriff Diggins told the board that he had established a community employee leadership council to engage the community in various employee groups. What is the status of that council and what has it done over the past year? The status of the council is that it is still active. And the most recent meeting we had occurred on September 22nd of 2021. Alyssa Perez Morrison from the Office of the Independent Monitor was present at that meeting, as she is at most of the meetings each quarter. We decided as a group very early on that we were going to change the name to simply be called the Leadership Council. So instead of the Community Employee Leadership Council, it's now titled simply Leadership Council. And over the past year, we really built a platform where those participating organizations can bring forth concerns to the department and also update each other about current topics that are relevant to each organization. The quarterly meetings were approximately 2 hours in length, and as I'm sure you all can understand, with so many different groups, the internal employee organizations and the external community organizations, 2 hours really just wasn't enough time for us to dig deep into topics.
Right.
It was really very surface level. And so I actually had the idea of, I'm getting some feedback, I'm not sure, there we go. I had the idea of going a little deeper with each of the groups. And so we actually broke out a separate meeting for each of those groups every single quarter, in addition to the quarterly meeting that we have as the Leadership Council. And I think that was a good idea. And I think the employee groups and the community groups thought so as well, because it allowed us to have deeper conversations with each of them. And so it's been going very well. Some of the things that have come from those meetings is problem-solving issues that have happened internal to the sheriff's departments. We've built some partnerships with many of the organizations for the Center on Colfax. We have done partnerships with beginning to do some recruitment in the LGBTQIA community, along with the Colorado Muslim Council, as well with the Colorado Criminal Justice Reform Coalition. Many of you saw that we had the first ever in-person voting that happened for the folks that are in our custody last year, and we continue to work with them as well, and just continue to problem solve things related to COVID and other issues that happen in the Sheriff's Department. So the Leadership Council will continue. I always look forward to those quarterly meetings and appreciate those groups bringing issues to our attention in between. That meeting is not just myself meeting with them, it's all three of my chiefs as well. So it includes Dr. Nikki Johnson as the Chief of Mental Health Services, Chief Vince Line, who oversees operations, and Chief Sonia Gillespie, who oversees our administrative division as well. So I'll stop there, pause, and ask if there are any questions. Hey, Katina.
Hi, Sheriff. Thank you for joining us this morning. I was wondering if you could share with us offline, I guess, just a list of the organizations and employee groups that are part of the Leadership Council. And then a clarifying question, did the folks who were in your custody vote this past election in November? I mean, yeah, last week, I guess, or this week, gosh.
They did. I'll be happy to send the list over to you all. And they did vote this past week because of COVID and because this election was more of a paper ballot of sorts. The Colorado Criminal Justice Reform Coalition, along with the League of Women Voters and our program staff, all decided that they would have a paper process rather than an in-person voting method, but we will keep the in-person voting method because it was so successful for future elections as an option.
Quick question, Sheriff. This new leadership board, is this the same as the used to be entitled the SAB that I was on back in the day, the advisory board? If it's not, how do they differ kind of in terms of what you glean from them?
Yeah, great question, Al. The Sheriff's Advisory Board, which we call the SAB, is actually one of the groups that participates in the Leadership Council.
Got it. Okay.
And
that's
the
what I want to
difference
know.
is we also have external community groups such as the Greater Metro Denver Ministerial Alliance, the Center. We have Indigenous folks. So there's a lot of other people. Plus, it includes all of our internal stakeholders, all 6 of the employee groups for the Sheriff's Department that participate as well.
All right, so there's 2 groups now.
Correct.
Okay. All right, thank you.
Sure. All right, I'll move on to the next question. Question 2, on August 6, 2021, Sheriff Diggins told the board that DSD was working on providing detainees with free phone calls through the PIN jail management system. What is the status of that project? And PIN is an acronym for a personal identification number. The PIN system is being stood up and will be put into place next week. Once that happens, we will have the ability at intake to offer free phone calls. So let me just be clear so that we can let everyone know what's going to happen. So all phone calls won't be free throughout our entire system, but we know that if we have the ability to offer free phone calls on the front end, when folks are first coming into our custody, that can help to facilitate them perhaps getting bonds made, letting their family know where they are if they are not sure where they are, without having to worry about those phone calls costing them or their families. The reason that we have to do that by PIN is because we have to make sure that we allow each person a certain number of phone calls when they first come in, but also sometimes, unfortunately, there may be things that we need to have recorded when folks make those phone calls. And so we have to be able to identify who that person is. Sometimes folks may be coming in under a domestic violence case, and we don't want them calling back to their victim to make threats. and us not knowing who that person is. So at intake, we're going to be having those free phone calls. And so the PIN system is going to be stood up next week, and then those free phone calls are going to follow very soon thereafter. As many of you are aware, we just stood up a brand new jail management system. It's the first time that we've done that in over a decade. It's been a huge endeavor. So we've been working through the challenges of trying to get that right. So we appreciate everyone's patience, and we'll be happy to report out when those phone calls, those free phone calls begin as well. And Julia, I see you have your hand up.
Yeah, thanks. And congrats on your big implementation. I think both Al and I can speak to the pain of big systems implementation and how resource consuming that can be. So great job if that's live and you didn't lose half your staff in the process of getting that on. The question I have is, so with these phone calls, it became particularly acute during the pandemic for folks in your custody to be able to access the phones as they weren't allowed visitors, et cetera. Just sort of wondered, how does that interact with the pandemic conditions and protocols in your facilities right now? And, just kind of speak to that a little bit, if you wouldn't mind.
Yeah, there have been periods of time during the pandemic. In fact, we did this twice. Once was actually at the recommendation of the COB, where we worked with our phone provider to make sure that we had some free video visitation that was occurring for the folks that were in custody. That worked out very well. Currently, that's not something that our facilities are doing, and most jails across America aren't currently doing that. We do, however, right now, have a free video visitation program that's occurring with the Public Defender's Office, along with the ADC office, the Alternative Defense Council. And I've been working directly with Demi Trujillo on that since the beginning of October to ensure that right now they have free access through the video visitation system to access their clients while they're in our custody. So right now, those free phone calls are not happening for the folks in custody, but they are happening for the Public Defender's Office. And if we need to revisit that during the pandemic, we certainly have the ability to go back and do that. But in talking in those circles that I'm involved in across the nation with other jails, that's not something that's occurring for most jails across America. And Stefan, I see your hand is up. Yes, sir.
Yep. Thank you, Sheriff. And let me first say that I have not mastered the ability to appear 3 times in the same meeting. For some reason, my video, a photograph of me is appearing in Al and Terrence's box here. At least that's what I see. I don't know what you all see.
Not on mine. I see
okay.
there.
Well, that's good. All right. All right. It's only me. It's only me. Just once. Anyway, Sheriff, so with respect to the free phone calls, when they are being provided, are setting aside that the video representation with their lawyers, will they only be provided to inmates upon initial intake?
That's correct.
Okay.
Only upon initial intake, but we also understand that there are times when folks may be having a hard time paying for those phone calls, and our staff works very closely with the people in custody. If they really need a phone call and can't afford to make one, we will make sure that they get a phone call. We have supervisors that walk through the pods and talk to folks, and some officers that request that from their supervisors as well. So it's not as if there is no such thing as a free phone call on our system. The vast majority of the phone calls that are made are those that go through the payment system. But here's what I can tell you, Steph. We purposefully, during our contract negotiations, made sure that our phone calls are the least expensive in the entire state of Colorado. In fact, they're probably some of the lowest rates that you will see across the nation. I'm involved in discussions through the Major County Sheriffs of America and other boards with ongoing conversations related to inmate phone calls. In fact, Congress is getting ready to take this up in probably the next session. Senator Tammy Duckworth from Illinois is going to introduce a bill that's going to talk about the regulation of inmate phone calls, and the caps that are being set by the FCC are at about 21 cents per minute. The Denver Sheriff's Department is proud to say our phone calls are all the way down at 0.8 cents per minute. So we're well below the cap. We do that because we know how important it is for folks to stay in contact with their families, how important that is to help them as they come back to the community. And it helps with ensuring that we're keeping recidivism low by being intentional with the things that do cost inside of our facility. So although we don't offer free phone calls for the masses, we do have the lowest rates in the state of Colorado and one of the lowest in the nation.
Okay. I just wanted to make sure, and I understand from your answer that that's exactly what you're saying, that there isn't just some bright line out there that free phone calls will only be provided to inmates upon initial intake, and that there will be a process in place to provide phone calls, notwithstanding the very low cost, which is great, to others who really need to reach out and don't have any funds to do so.
Absolutely.
Okay, thank you.
Al, I see your hand is up.
Yes, this is just a question kind of regarding those phone calls. Do you know, or does the sheriff department make use of, or is there a grant that's available federally that enables you to keep those costs low? And I ask that question because we want the longevity of the sheriff's department ability to keep that low. And I'm wondering if something like that you're benefiting from to kind of offset that and to encourage it to keep going.
There's no federal grant that allows for that. It's really our intentionality in making sure that we're looking at each of our contracts to keep those costs as low as they can be for families. And I think
Okay.
that's really something that we truly believe in.
Got it. You know, I'm just because when we cross this kind of threshold right now with COVID and low, the jail having low occupancy right now, when that pendulum kind of swings in the other direction, which I hope it never does, but when it does, then that's when things start being reconsidered and cut. So I'm just thinking long term there. So if it's part of you're saying it's part of your a program in terms of how you guys approach it, then okay.
All right, thank you, Al.
Yeah, thank you.
All right, next question, number 3. During the board September 14th, 2021 public forum, members of the community provided detailed and concerning allegations about substandard food service being provided by Aramark. Executive Director of Safety Robinson was present and promised to look into it. Have you been involved in looking into those complaints? And if so, what progress have you made? I have been, and in fact, Director Robinson contacted me immediately after that meeting and shared with me the concerns that were brought forward, and also his wish that we make sure that this is absolutely a priority for the Denver Sheriff's Department. He and I are both in line and making sure that we're providing the best food service that we can. Here's what I'll tell you all. We have a major who is assigned to oversee every single one of those complaints. Major Lance Alexander, who oversees the county jail, oversees the entire food service program. He has been working directly with the folks at Aramark to address those concerns, and he has met with them no less than 15 times to make sure that we're marching forward with providing the best food service that we can. And we take every single one of those concerns seriously. And recently, Chief Line, also who the Chief of Operations, who Major Alexander reports to, has done a deep dive into every single one of the grievances that's been submitted related to food service, and has graphed out where those food complaints are as far as each category. And what I can tell you is that what we're seeing is complaints related to perhaps the quality and perhaps quantity, and you'll see that across the nation. One of the things that we recognize is it's very hard to produce 5,000 meals every single day and to make sure that every single one of those meals is on par with the expectations for hundreds of people. And that's a part of food service. But what we want to do is make sure that those meals are absolutely nutritious, that they are what we call palatable in the jail world. And we address those concerns by sharing with folks that if you have a concern, bring it to our attention, and we're going to tell you what may have happened as far as that meal may have been concerned, and address that with the food service provider so that they can improve the quality of those meals. It's going to be an ongoing topic of conversation for us. Myself, along with all of our executive staff, is required to also sample those meals randomly. One of the things that I know, and I kind of learned this from Colin Powell, is if the folks that are in charge are eating the food, the folks that are preparing it are more likely to make sure that those meals are of quality. That's our expectation for our food service program. That's what we're going to continue to work towards. This has been something that has also been a transition for us. It's the first time in the history of the Denver Sheriff's Department that we've used an outside vendor to produce food service. It's always been an internal operation for us, but at almost the same time that we transitioned for our new jail management system, we did the same thing with bringing Aramark on, and we're going to continue to push them to make sure that the quality is of the expectation that the community expects, as well as the folks that are in our custody. Julia, I see your hand is up.
Thanks. Palatable is a really low standard, I feel. It does feel important, I think, at the basics for justice involved individuals to be treated like human beings, and food is sort of one of the basic necessities. So just to start the comment off with, palatable feels low, and good to hear that you on occasion eat those meals. I guess the question is, would you feed that meal to your family is maybe another standard. And I wondered, based on the descriptions, if that would be true. You don't have to answer that question. The question I have is, do we have performance metrics or any sort of accountability tools built into the Aramark contract that allows us to take more aggressive tacks with them than just saying, please make it edible and please make sure there aren't screws in the food and things like that. And if not, I'd encourage us to look at the next round of contracting and make sure that we've got some real hooks to ensuring that they're providing food to human beings.
Thank you, Julia. I appreciate those comments. And let me just go back to the word that I use, palatable. For the American Correctional Association, which sets standards for accreditation for jails and prisons across America, that's where I got that word palatable from. And it's one of several standards that is used to measure food in jails and prisons across America, along with, is it pleasing to the eye? Is the quantity enough for an adult? There are caloric standards that we have to abide by. And each of those meals is reviewed by a certified dietitian as well. So it goes beyond just being palatable. I can tell you that it's very challenging to produce food in masses. You were talking about my family. My kids sometimes complain about school food, right? And when I've had family members that are in the hospital, they complain about hospital food. I think it's very tough to produce food in mass and to please everyone. But what we want to do is raise the bar and continue to drive forward to make sure that we're ensuring that folks are getting a meal that that meets all of those different standards. So thank you for that. We do have those performance metrics for Aramark in place, so that if they're not performing to those standards, then we can address them and perhaps change course during the course of the contract. Aramark is a national company. They pride themselves on the reputation that they've built throughout the years and throughout the country with the food that they provide. And I believe that they're going to step up to the plate to make sure that they protect that reputation as well. Stefan, I see your hand is up. Your microphone is still muted, sir.
You're right. Yeah, I may appear 3 times, but you got to hear me, right? Anyway, following up on Julia's question, did you find that there were some validity to the complaints that you say that you looked into after Director Robinson, brought these things to your attention? And if so, what improvements were made as a result of your looking into those particular complaints?
We did find some validity in some of the concerns. What we have done is made sure that the meals that are provided are of the standard that Denver expects, making sure that every single meal has the quantity of food that folks should be getting while they're in our custody, making sure that things like salt and pepper are on every single plate. And some of it is the quality control that happens at the line level as well. So although the menu may call for a certain quantity of food item to be put on the plate, it's making sure through quality checks that happens. And so the management team that oversees Aramark on the ground, as well as Major Alexander and Chief Line and I, are making sure that those things are happening. So those quality checks are in place. We believe that the food service program is going to continue to get better.
Sheriff, is there anywhere where we can get some of the information on the quality control checks? I know you just talked about some of the metrics of the nutritional value, quantity, but is there some kind of document that we can see?
Absolutely. I'll have Major Alexander provide that to us. And I believe Chief Line has already provided some information to Armando Soldate, the Deputy Director for the Department of Safety, which he was going to share with the board as well.
Thank you. Because sometimes I get questions even for individuals with like specialty diets. So vegan, vegetarian individuals, individuals with different cultural and religious beliefs and thinking about diet. So just wanting to make sure those are on the metrics and we're evaluating those concerns too.
Absolutely.
Thank you.
All right, seeing no more questions, I'll move on to the fourth question. The board would appreciate an update on DSD staffing levels and retention, particularly when it comes to the jail. We are currently 215 deputies below our authorized strength. And we are working very hard to turn the corner and begin to have those numbers go in a upward direction. What we are doing is through the collective bargaining negotiations that we're having now, addressing concerns that our staff has related to pay and benefits. And I can tell you that Mayor Hancock, Director Robinson, Alan Salazar, everyone who is involved in those negotiations from the city side is very much on board with working closely with the Fraternal Order of Police, who is our collective bargaining agent, to address the issues that our staff has related to retention. And for recruitment, our recruitment team, along with Safety HR and the Director of Safety's office, is working extremely hard to spread the net as far as we can to get folks to become a part of our organization. I'm happy to report that next Monday, we have a class of recruits that's starting in the academy, and that number currently is at 20 recruits. It's been a challenge to bring folks on board throughout the entire country. As you all know, there are not now hiring signs everywhere. And for us, it's the same thing. It's been a challenge to bring people on board, but we have an optimistic view of the future for the Sheriff's Department. And knowing that we have 215 vacancies for the deputy position is going to give us the opportunity to bring folks on board that have the philosophy that we have with leading with humanity and understanding that the deprivation of someone's freedom is their punishment. So our recruitment team is going to continue to work very hard to bring good folks into the department. And we want every single leader inside of our agency to understand how valuable our employees are. And so retention is something that we're all going to work towards. And we have the support of the mayor and everyone down inside of the city to make sure that we're doing everything we can to retain good employees as we move forward as well. So I'll open the floor for questions. All right, seeing none, I'll move on to question 5. The board would welcome a response from Sheriff Diggins about the firing of Brett Gariani. The board is particularly concerned that Gariani, who would have been fully aware of the proper policies given his involvement in the death of Michael Marshall, reportedly told investigators that, quote, I feel that I handled it in the exact way that I was taught to handle situations like this, end quote. I can't comment on this matter as it is currently under appeal. And I'm sure the attorneys who are on the line, and there are a number of you, can certainly understand that. I can't say anything about question number 5, but would like to open the floor for any discussion.
We'll come back to you on that one then. Make a note. Questions from other board members?
All right, seeing none, I'll move on to number 6. The board is also hoping to hear from Dr. Nikki Johnson about DSD's priorities in the area of mental health services. And Dr. Johnson, that is your cue, and I will turn it over to you, ma'am.
Good morning, and thanks to the COB for inviting me to speak today on the priorities for the mental health services for the Denver Sheriff Department. Just a brief introduction, I'm Dr. Nikki Johnson, the Chief of Mental Health Services for the Denver Sheriff Department. I started in this role in January, and this was a new position created by Sheriff Diggins, really to serve as his delegate for all things related to mental health within the department, also to represent the community and the department and attend any stakeholder groups as well. So I'd like to go over, well, first of all, just give you a little overview of my background. I've worked in jails and prisons for approximately 15 years and in the behavioral health field for 20 years. And I'm a licensed psychologist and a certified addiction specialist. So I've spent the majority of my career working in the Department of Corrections and also the Jefferson County Detention Facility as well. So really focusing on my priorities for 2021, Sheriff Diggins and I sat down and had some priorities for me to really focus on over the last 10 months. The first one being the implementation of the competency restoration program. So this, what is a pilot program that we started at the county jail on May 10th of this year. And what we did was we took 12 beds from the transition unit that we had already in place. So it was 12 of the 48 beds of the male transition unit, and have worked with the Office of Behavioral Health and Disability Law Colorado and Denver Health and Hospital Authority to provide restoration services for individuals who have been found incompetent to proceed. What we found with our program thus far, even though it has only been 6 months, we've seen 12 individuals who've been restored to competency with an average length of 56 days for that restoration. So that's something we've been really, really proud of. In addition, a second priority is working on the implementation of the crisis response team. And some of you may have seen kind of the attention that we've received around that. It's a brand new team that we're putting together. It'll be a team of mental health professionals who will really work alongside to support the deputies in their response to any type of crises that occur with individuals with serious mental illness. And not only responding to crises, but also preventing crises from occurring. So really working to develop that therapeutic rapport with individuals in these special management units and focusing on our intake as well, because we do see a high number of crises occur within that setting. We currently have 2 members of that team who've started, and we have another 3 who are in the onboarding process. So we've been actively recruiting and interviewing for that team, and we'll have more data to come in 2022. And the final priority for 2021 has really been to look at all of the mental health services that we're providing, focusing from entry to exit and ensuring that we're really providing best practices in everything that we do. And also ensuring that we're providing culturally relevant mental health practices as well. Throughout that audit process, one thing that has been apparent and something that I focused on is really getting some of the individuals with serious mental illness out of their cells more And in doing that, we developed a mental health step-down unit. And this is basically a more open unit where we're able to transition individuals out of restrictive housing into this unit that has fewer incarcerated individuals and also has incentives such as headphones and library services. We're also able to provide them with more programming and therapeutic services as well. So moving on to basically our priorities for 2022 in regards to mental health services, we do plan to expand the restoration and transition unit. So we will work with the Office of Behavioral Health and with Disability Law Colorado to determine what that will look like, but moving really from more of a pilot program to a full operational program is the goal. In addition to that, we plan to create a female restoration transition unit. These are few and far between across the nation. However, the sheriff's goals have always been to provide gender responsive services and really to provide those equitable services for males and females. And in doing so, we'll be creating the restoration and transition unit for the female population. In addition, like I mentioned, we'll really be working with the crisis response team to track the data. And we hope to see a decrease in use of force and also any kind of assaults on staff with the implementation of this team. I'm also working with the DU and MSU, Metropolitan State University, several professors in both of those schools to really look at a 5-year suicide analysis. So we'll be looking at all of the serious suicide attempts and also suicide completions within our custody over the last 5 years. We really have a responsibility to keep these individuals safe while they're in our custody. And so we want to identify any type of gaps or potential areas that we can improve on in that area. We will also be focusing on diversion and reentry. So in doing that, we've been working hand in hand with the Denver Police Department on their diversion center. So really focusing on the assessment, intake, and diversion center, and increasing collaboration with our internal and external partners as well. So between the crisis response team, programs, the Denver Health Behavioral Health team, and any community partners. So we can really ensure we have that warm handoff and individuals are leaving our custody better than when they came into our custody. And finally, most of you are probably familiar with the House Bill 21-1211, getting individuals, it's basically unrestricted housing for individuals with serious mental illness. And that will definitely be one of our focuses for 2022. And it may mean implementing more mental health step-down units and similar type of units where we're really getting these individuals out of their cells more and learning some of those skills that they need to have in order to be successful in the community. So that really concludes and is a brief overview, and I'd be happy to take any questions. It looks like Julia, you have a question?
Yeah, thank you. My question actually sort of connects to question number 5 that we asked, but moved on from with the sheriff. So 2 questions here. The first is, what's your role in supporting or addressing mental health issues among the deputy population? So the actual employees of the sheriff's department. And then, depending on your answer to that, I think in 2017, the COB in collaboration with the Independent Monitor sent a letter regarding, the light treatment of Giuliani, I don't know how to say his name right, with regard to the death of Michael Marshall. And so, sort of concerned with early intervention or appropriate action at the time that can address sort of mental health issues or trauma in the deputy population. And I'm not necessarily connecting those 2 things, but just sort of wondering, what's your role with the deputies? What kind of programming do we have to address sort of early intervention when we see it in that population? And, how do we think about that in the case of recent events?
So my role is really more specific to the incarcerated population. Chief Sonia Gillespie is our administration chief. And so she is over our wellness program and over a lot of those services. We work with Nicoletti and Plater and have access to their services as well in terms of therapy and those sort of things. So I'm always available and consult with Chief Gillespie on those kind of items. However, it's not under my umbrella, so to speak.
So separate channels for those two things. Okay.
Julia, and I'll just piggyback on what Dr. Johnson talked about with Chief Gillespie and the administration division. We have an entire employee wellness initiative for the Denver Sheriff's Department that includes an outreach coordinator who works specifically to navigate through when employees have been identified to perhaps be having challenges, sometimes with mental health inside the department. We work very closely with providers, outside providers, to make sure that we're providing them resources. We also have a full-time physical therapist and deputies that are assigned to help them with their physical health as well. So the health and well-being of our staff is absolutely important, and it's not just for the deputies, but also for our civilian staff as well. So any member of the Denver Sheriff's Department can access those services.
Okay, great. And then as a follow-up, I know that the DPD has sort of an early intervention program that helps to identify officers who may need retraining or, sort of expose violent tendencies at work or maybe sort of misappropriate use of force early on. But I understand that the Sheriff's Department does not have that. Can you speak a little bit to the scoop on that?
Well, we do have some early intervention work that's done throughout the Sheriff's Department. Additionally, as we begin to navigate through cases that come forward, and Greg can attest to this, we do identify when folks perhaps need retraining or perhaps need some additional work that needs to be done to get them back on track. And we ensure that every single time that happens, that goes through our training academy or that is done through their supervisors as well. And we have those recommendations that come in addition to perhaps discipline that's issued, or sometimes when discipline is not issued, we may have those recommendations that are made and they go back to the training academy to revisit those tactics or perhaps to get some additional training as well.
Thank you. Other questions from the board for Dr. Johnson or Sheriff Diggins? Okay, well, really appreciate your time and the follow-up on our questions. Sheriff, if there are other topics that you were hoping to cover with us or things that you would like to update us on, we've got a few more minutes. Otherwise, we can give you 10 minutes back in your day, which also might be nice.
No, certainly appreciate the opportunity to come and answer these questions, and great follow-up questions as well, and appreciate everyone's support of our department. If you know good folks who want to have a career in service, we are hiring and would love to have you recommend folks to become Denver deputy sheriffs. So don't have anything other than that.
Oh, Stefan, go ahead.
Yeah, Julia, I'm not sure, and maybe I'm speaking out of turn. Were we going to ask the sheriff to address the Robertson complaint?
Yeah, that's right. So we can transition to that agenda item, and Sheriff, if you'd like to stay on for that, that would be helpful. Thank you for the reminder.
Sure.
Okay, so with that, Ms. Robertson, if you would like to join as a participant or a panelist, Daniel, if you can move.
I just promoted her. It'll probably take a couple seconds here.
Hey there, can you hear me? I don't see my picture coming up, but I just wanted to make sure you could hear me.
We can hear you just fine, thank you. And if the whole board is here, if you'd like to begin your comments, we're happy to hear it.
Just let me know when you want me to start.
Go ahead.
Okay. Good morning, Sheriff Diggins, Dr. Johnson, and the COB board members. Thank you for everything that you do. My name is Janet, and my son was taken into custody to the Denver Detention Center on September 23. This was a temporary situation for my son pending his transfer to a permanent federal facility. My son is diagnosed with anxiety, depressive disorder, and PTSD, and has been taking a daily regime of psych meds and MET for his opioid addiction for over 2 years with a huge amount of success. My son had a team of 3 doctors working together with him on his recovery. My son has been sober for almost 18 months. There are 4 things I'd like to bring to your attention and get your feedback on. The first being eyeglasses. My son wears daily contact lenses and glasses. The Denver Detention Center refused to take my son's eyeglasses from his lawyer when he entered this facility. His lawyer was told my son would receive an eye exam and they would decide if he needed them. My son complained bitterly to a nurse that he needed his glasses to see. It took more than 24 hours to get approval to be able to have my son's lawyer drop off his glasses again at the Denver Detention Center, but it took 6 days for my son to actually receive them due to the internal Denver Detention Center procedures. My son had to wear those throwaway contact lenses for 6 days so that he could see, even though they were meant to be used for 1 single day. The second thing is the delayed access to medications. My son detailed to the intake nurse at Denver Detention Center all of the meds he was on and his MET treatment. She acknowledged this and said they would verify his meds with his pharmacy and get them to him. This never happened. My son filed numerous kites for assistance, and when I spoke with him on September 27, which was 4 days after his intake, it was very clear he was deep in withdrawal from his meds. He was extremely panicked and was beginning to sound manic. We advised him to file more kites and ask for help. My husband and I, in desperation, hearing how bad my son sounded, went to the Denver Detention Center with all of his meds in their prescription containers to prove he needed them. The sheriff on duty was helpful and called to the nurse's station on floor 3. He detailed all of the meds we were showing him and verified these were legitimate prescriptions and gave her the pharmacy details again. The nurse verified these details were exactly as my son had filed out on his intake form, which they had never actioned. She agreed to call the pharmacy and verify them there and then. My husband and I sat and waited. The nurse then called the sheriff and said the pharmacy verified everything and she would get my son started that night on his meds after running it by the head nurse. The sheriff reassured us that things would work out, so we left. My son had no idea we were at the Denver Detention Center. I spoke with my son the following day, which was Monday, and he told me that his level of panic had increased and he did something he shouldn't have. He told me on the Sunday evening his cell door opened for another inmate and my son stood up and walked out with another kite form and begged the guard to be allowed to go to the nurse's station. The guard allowed him, and once he got to the nurse's station and told her his name, she knew exactly who he was. She checked him over and told him she could see he was very sick. She apologized to him for that he did not receive his meds. She started him on meds and revisited him later that evening as well with more meds. And then on the Monday morning, she started him back on his mat, his Suboxone. He had been without any of his meds for more than 4 days. I was so relieved to hear my son tell me this, and I did let him know we had been to Denver Detention Center. He couldn't stop thanking us for doing that, as he said it had clearly made a difference and said if we had not done that, he believes they would have continued to leave him to withdraw. I had a meeting with my son's psych doctor, and I told her what was going on. She was also horrified. She sat for a few minutes and then asked me, are they trying to kill him? She told me that if they stopped all of his meds, they were likely to put him into cardiac arrest and or kill him. I was beyond distressed hearing her reply. This takes me to my third situation, the sudden stopping of one of his medications, a benzodiazepine. All seemed okay for several days, and then my son let me know that the psych nurse told him she was cutting him off his med, the alprazolam, which is a benzo. He tried to explain to her he had been taking this medication successfully under doctor's management for years, and this was part of his daily regime. She was not having it. She started to rapidly taper him off. This was mind-blowing to me, as it is beyond dangerous to rapidly take anyone off this medication, especially given the duration of time he had been successfully taking it. A slow taper is the only safe way to stop this type of medication, as a quick taper can cause cardiac arrest, seizures, and death. At a minimum, any kind of a taper essentially puts a person into withdrawal that can last weeks to many months. The nurse was not willing to do a longer taper. I went to the Denver Detention Center again on October 4 with letters from my son's psych doctor and Suboxone doctor, which stated the meds he was on, the dosage, why he was on them, length of time he was on them, etc. I also took an ROI, which is a release of information form, from his psych doctor with me just in case they needed to reach out to her for more information. There were two sheriffs on the front desk. I explained why I was there and asked if they could help me and that my son needed his meds. They called up to the head psych nurse and explained, and she sounded really angry and started to say she could not speak to me for HIPAA reasons. She needed an ROI from my son to speak to me, etc. The sheriff asked if she could bring an ROI down with her, but more chatter came, making excuses. Then she agreed to come and speak with me. On arrival, she was extremely annoyed and had another nurse with her. She again emphasized she could not talk to me without an ROI. So I let her know I understood, and I continued to tell her I had letters from my son's medical team and showed them to her that he needed to be on these meds. She read the one from the psych doctor and told me she had the same qualifications and threw it back to me. She told me they were doing the taper, and I asked her not to do this as he needed the meds as part of his mental health regime. I also let her know my son was being moved and begged her to just leave him on them, but she said no. I asked her to please be human about this, and I showed her the ROI I had if she wanted to speak with his psych doc. She would not take it. I was beyond distress and in tears. At that point, she told me she could not spend all of this time on my son. She had other people who were suicidal and needed attention. She then told me to file a grievance and walked off with the other nurse. I looked at the sheriff on duty and I could already see he was writing something. He urged me to go forward and I asked him what to do now. He handed me a piece of paper with the grievance department phone number on it, and he told me to call them as they may still be there. He then told me if not, leave them a message, they always call back. I did call the number and I left a message. I did speak with my son and explained I had been there again, but this time with no joy, and they were going to continue the taper. I suggested he try to reach out to the psych nurse and talk to her about his needs again. The fourth thing I would like to talk to is the side effects of all of the stopping and starting of my son's meds and the issue of clean clothing. My son also brought to my attention, because of the withdrawal he had gone into initially and then back on meds, then get tapered off again, that one of the side effects was chronic constipation, which he reported to the nurses and on kites, and that he was now bleeding. He received Metamucil once, and then the nurse told him she would get him milk of magnesia. This never happened. My son told me he was still in the same prison scrubs, underwear, and socks that he had been given the first day. He had been wearing the same clothes now for 12 days. He asked a guard for clean clothes, but the guard said, no, they come once a week, and you missed it. My son ordered underwear and socks from the commissary, but they told him it took a week to arrive. He was disgusted at the conditions of the clothes he was having to wear. I spoke to my son the next day, and he told me he could not stand wearing now 13-day-old socks and underwear, and we just have to remove them and wash them in the shower and hang them to dry in his cell. Again, he was mortified at this situation. My questions for you. There is too much chatter about mental health, and there is no recognition of this at Denver Detention Center. Why? I believe the number is as high as 74% of inmates have documented mental health needs, yet they are neglected. The intake nurse could have easily called the pharmacy and verified my son's meds and dispensed them to him. Why did she not do this? Why did no one follow up on my son's medical needs, kites, etc., until I went and protested? Why did they make him go into withdrawal and cause him so much mental and physical pain? Why are the psych nurses not reading the inmate's history of what meds they are on, for how long, before they decide to cut them off? Why do these psych nurses not know the damage they are doing to inmates? Or if they do, why are they torturing inmates? Why is Denver Detention Center not providing regular clean clothes to inmates? Why are inmates having to pay $7 per kite just to have someone read it with no guarantee they will action it? What if an inmate has no money to pay for a kite? What do? Mental health illnesses are a disability. So if they are being controlled by doctor-prescribed meds, why would Denver Detention Center interrupt that and incapacitate an inmate? I believe nurses are there to heal and not hurt. So why are they following such damaging protocols? In summary, this sounds like a lot of complaining, and it is. But I believe we can all do better, and we should do better. I would like to be part of the solutions. I don't believe it to be rocket science to just change the initial intake procedures at Denver Detention Center and elsewhere for inmates, verify their med needs, and dispense these to the individuals without interruption. When it comes to mental health, I cannot believe Denver Detention Center or elsewhere would want to destabilize an inmate. Something as simple as accepting an inmate's eyeglasses so they can see is beyond remedial. And again, why would they deny this other than to cause distress and pain? Clean clothes are a basic, essential hygiene need. This situation needs to be resolved. Again, I find this remedial. Holding the nursing staff accountable for their actions needs to be in place. Filing a grievance while the nursing staff continues to deny medical assistance while someone looks at a grievance is ineffective and dangerous. I was informed that since my son had moved facilities, Denver Health deemed the grievance I filed and the numerous grievances my son filed closed out as he was no longer there. Unfortunately, I don't agree with that and want answers and solutions for better practices. Now knowing what I know, I believe we need advocates for inmates. Not everyone has someone to advocate for them on the outside, and I believe many are fearful to complain and just accept. This is wrong. I know it is possible to do things like drive-alongs with police officers and observe what goes on. I believe a similar type procedure should be developed for drop-ins at the likes of Denver Detention Center and elsewhere to watch their procedures and discuss with inmates any needs they have that are not being met. Finally, I know the medical services at Denver Detention Center are a separate contract to the sheriffs and officers working there. If a sheriff or officer knows that the medical staff are potentially causing harm, why do they not file a grievance too? These officers saw what went on, but told me they were a separate body and could only ask the nursing staff to help. This needs to be changed. Thank you so much for listening to me and allowing me to speak. And please let me know how I can help and what happens from here.
Ms. Robertson, thank you for sharing that with the board and the community. Dr. Johnson or Sheriff Diggins, do you have any answers for her questions?
Yeah, let me first start off by saying I'll be limited in what I can say because the matter is still under an active investigation, which is being conducted by our administrative investigation unit, which is overseen by our public integrity division, and also being monitored by the Office of the Independent Monitor. So Greg Crittenden and his office will be monitoring this case as the investigation proceeds. Mrs. Robertson, let me first apologize to you for anything and everything that may have occurred with your son. As the sheriff, regardless of whether it's someone in uniform or a contractor, the buck stops with me. And I will assure you that a very thorough investigation will occur regarding everything that happened with your son. From a general standpoint, let me just say to you that our expectation is the same that you have, that our medical provider, Denver Health and Hospital Authority, not only helps to heal people, to never hurt anyone, but to also help them as well while they're in our custody. And I can tell you that the expectation from their leadership team is the same, that they have the exact same philosophy. And as they are looking into this matter, we will ensure that the standard of care that you and the rest of the public has for them is upheld. Related to your specific complaint regarding your son's grievances, I will ensure that not only are those not closed out, but that you will also receive a phone call, and perhaps if you want to, a in-person meeting with the Health Services Administrator, Carmen Casale, regarding this matter as well. So I want to just share that information with you. I'm going to ask Dr. Johnson to give an overview of things that happen on the mental health services side, because she works side by side with them in regard to their practices. From an operational standpoint, let me also share with you, we do take the health and welfare of the folks that are in our custody very seriously. We have laundry exchange every single week. It goes very well for the folks that are at our custody. So I'm very curious and anxious to hear more through the investigation as to why that possibly did not happen with your son. So I'll be looking forward to those answers as well. So I'll ask Dr. Johnson to talk, to give an overview of the services, the mental health services and the triaging that occurs with that.
Mrs. Robertson, first of all, I just want to say thanks for coming forward with this information and for being such a strong advocate for your son. I wish that a lot of our incarcerated population had family members like yourself, because I do believe that for individuals to be successful in the community, they need people like yourself. And so first of all, I just want to say thanks for being that for your son. Just speaking in regards to our medication verification process. So when an individual comes into the jail in the booking process and they report being on current medications for mental health reasons, the nurse in booking starts that verification process immediately. Unfortunately, that doesn't necessarily mean the pharmacist or the pharmacy is available 24/7. So some of the process depends on the pharmacy where the individual is getting the medications, the time that the individual books into the facility, the response from the pharmacy. Sometimes it's leaving a message and continuing to try to get a hold of the pharmacy. So on average, I can say that it usually takes somewhere from 24 to 72 hours for medications to be verified. In regards to your son being on benzodiazepines and the withdrawal process and that sort of thing, what I can say in regards to that is most jails limit the number of benzodiazepines that are prescribed within our facility. They're often considered non-formulary medications due to their high potential for abuse and also high potential to be misused or sold within a jail setting. So it's pretty common for someone who's coming in on a medication like Xanax to be tapered off of that medication. We have a benzodiazepine withdrawal protocol that's usually from 5 to 7 days, where the nursing staff monitors that individual for any kind of side effects or withdrawal symptoms, and also can provide an additional medication to assist in that withdrawal process if they have severe side effects. So that kind of sums up from a more high level perspective, also keeping into account the confidentiality that the sheriff spoke to, but I can answer any other questions you have. Julia?
Yeah, I guess I just am sort of interested in, like, why would we taper people off of medications that had been prescribed by physicians to them? And are we creating conditions where people are released back to the public extremely unstable as a result of, sort of being on protocols and then coming in and then going out without the appropriate treatment? It just feels like we're perpetuating our own, negative mental health sort of death spiral here. And I just don't quite understand the logic.
So with benzodiazepines being so highly addictive, I do see a lot of psychiatrists trying not to prescribe those medications. Basically it's masking the anxiety. And so there's other types of treatment that are more evidence-based treatment in regards to therapy and using some other form of medication that may be a better option. So I can only speak in regards to that, and knowing that when someone's put on a benzodiazepine, anytime that they even would decide to come off that medication, there's usually a rebound effect where they have an even stronger increase in anxiety. So again, it's more of a Band-Aid approach, and I'm not a psychiatrist, so I can't speak directly to why that approach continues to be used, but I know that that's not necessarily the practice, the evidence-based practice at this time.
Mrs. Robertson, I know you have a question. If you would like.
Yeah, Dr. Johnson, I completely understand, what you're saying, but my son had been seeing a psychiatrist, psychologist for years. They tried all kinds of medications for my son, and most of them were having an opposite effect, which no one understood. So they did genetic testing. So that's why he was prescribed the medications that he was given, because they actually worked for him. And we're all individuals. And I think genetic testing is an amazing tool because it helps us understand the individual, how their brain works, how it processes different chemicals. So I think the long-term treatment for my son was to eventually wean him off of benzos. But given the level of anxiety and everything that was going on in his life, that was the wrong time for it. So I don't really think the protocols that you're suggesting for someone that's been on benzos for years to be tapered off in 4 or 5 days is a good idea. And it is going to have withdrawals for months. And I think you know that too. So I don't think that's a great protocol. I think we need to treat people as they become inmates as individuals and look at what their needs are and why they're taken, why their psych doctor, has been prescribing these things, and come up with a plan on, how to advance them. But to cut them off in 4 or 5 days, I think is highly dangerous.
Thank you for that.
Mrs. Robertson, we can definitely discuss that more with Denver Health and Hospital Authority. And kind of the direction that we want to go moving forward in similar type of cases.
That would be great.
Katina, you have a question?
Yeah, just very briefly, this is all very interesting to me because I don't have a medical background, and I think I'm intrigued, or at least I'm trying to better understand a policy where when an individual is in the custody of the sheriff's department, the sheriff's department sort of has made it, is it a policy that you're going to make your own decisions about like the mental health needs of every inmate, despite what their physicians have already prescribed or are requiring for their medical condition? I think I'm understanding the concerns, for example, that Dr. Johnson just expressed about benzos, and then I'm hearing Ms. Robertson explain that there is a physician's care that this individual had been under. So are we saying that we have a policy just hands down that we kind of supersede that, and we decide what our doctors think or what our psych nurses think is best for an individual will trump basically what the individual's own doctor is saying? I'm trying to understand that policy, if that's what it is, or if not, why we would take an approach where we're going to decide ourselves what we think is best for someone who's already under a doctor's care.
Yeah, Katina, that's really a Denver health question. It's not the sheriff's department that makes that decision. That's purely a Denver health decision regarding medication and the continuation of those medications. What I know is that Denver Health does work directly with those physicians and those pharmacies to try to utilize a similar or same formulary when it comes to the medication that someone may be on. There are literally thousands of medications that exist for people, and for Denver Health to try to match them is something that they work towards, and to also attempt to work with that person's medical provider as well. I think we will probably muddy the water more than it could be. I would prefer to have Denver Health come and talk about this in a more intimate way than Dr. Johnson and I ever could, and can definitely make arrangements for that conversation to occur.
Yeah, thank you for that, Sheriff. I was actually going, that's where my head was well, I want to talk to them, because
Yes.
I really need to understand why we're not, if you have the person's doctor's notes and doctor's prescriptions, and you have those specific medications that literally they're providing to you, why we wouldn't use them, as opposed to, doing our own thing, or what Denver Health thinks. So I love to have that conversation, and if we can arrange that, that would be great.
We absolutely can. And I see Greg has his hand up.
Yeah, Sheriff, thank you. I think there might be a miscommunication as to who's investigating and monitoring what right now that we might want to both look into. I know we have brought Ms. Robertson's complaints to the attention of AIU. However, I'm not sure that there is any active investigation. And I know our jurisdiction is limited to sworn officers as opposed to medical personnel and to the nursing staff by ordinance and charter. But if you have time today, let's get together and look into that based on what your understanding is and what my understanding is.
Yeah, it was my understanding that the monitor's office supplied the AIU with this information, and that they opened up a case. And I'm not privy to whether or not that case, or what the conclusion or what the determination for that case currently is. Do you see a case in the system?
No.
Okay, well, I would defer back to Greg Huff and his team to see if they have done anything as it relates to any operational considerations for our staff. So we can circle back and talk about that later on today.
That'd be good. That'd be good.
So in terms of follow-up for Mrs. Robertson, how shall she ensure that, this is being tracked somewhere?
So we're going to ensure that the health services administrator contacts Mrs. Robertson. Julia, if either you or Daniel will forward her contact information to me, I will ensure that they are connected today so that she can get answers directly from Denver Health as it relates to any concerns related to anything that happened with Denver Health. And Greg and I will talk about any operational considerations. And here's why I believe there may be some. Mr. Robertson reported that he spoke to one of our deputies and did not receive a change of clothing, or was told that laundry exchange would not happen for another week. And those absolutely are not within the policy of the Sheriff's Department. And so we need to make sure that we look into that. So in looking at this from a total view, from a total lens, we got to have one track that is a Denver Health track, but also a track that involves any actions taken or not taken by our staff as well.
Sheriff Diggins, sorry, let me.
No, you go ahead. Go ahead.
Okay, Sheriff Diggins, I really, really do appreciate everything that you're, willing to do for us, and likewise, Dr. Johnson. But, it seems to me that perhaps when you take people into custody, if you know how long you're going to hold them, why not give them multiple pairs of socks and basic essentials? Why do they get one pair and then they're completely relying on someone giving them more clean clothes? I mean, that's to me seems like a really easy, simple thing to do. I mean, I just don't think it's that complicated.
I agree with you, Mrs. Robertson, and that's not our practice as well. What I can tell you is that we do give them more than just one set. And so that's why I need to have this investigated further, because that's not our practice. And so I need to look into it more to find out exactly what happened.
Okay, thank you.
Yes, ma'am.
I think too, let's not forget the issue of the glasses. You know, having someone wear contacts for 6 days seems incredibly dangerous. And, you know, it just seems like there's a lot of handoff issues here. The other thing I want to make sure we raise to the attention or in the discussion is that, you know, deputies were seeing these things happen and not, you know, necessarily intervening. And so there does feel like I understand the role of Denver Health, and this is human beings watching someone suffer. And so, you know, I'd like to a little bit understand too the role of the deputies in providing basic assistance and ensuring the safety of someone in custody. When we bring on Denver Health also, I'd like to just maybe have the board get smart on MAT and, you know, what the sort of standard protocols are for, you know, addiction related protocols in the facilities. You know, with this increasing in our community, I think it's really important for us to understand sort of what's the standard practice, what can be expected, and, you know, how should we understand that? Should we see more kites or grievances? Stefan, go ahead. You're on mute.
Did that again, sorry. I have a follow-up on Katina's point. I think also, Sheriff and Dr. Johnson, part of what ought to be discussed with Denver Health with respect to the protocol is, in this instance, as I understand from Ms. Robertson, that she did provide an ROI from her son's treating psychiatrist. So it was an opportunity, if there was a concern about continuing to provide him with benzo, there was an ROI and an opportunity for the staff psychiatrist, nurse, et cetera, to follow up with that doctor and to, you know, confirm the importance of him remaining on that drug. And if there was a concern, Dr. Johnson, you raised about, you know, the potential for abuse and or sale of benzo in custody, I think you could simply monitor it with this, you know, I know it's an individual situation with that inmate, to make sure that that inmate was taking that medication in the proper dosage that was prescribed by his psychiatrist. Again, I'm not a doctor either. I don't have a medical background, but I just think there was an opportunity to interact with the person who had prescribed this as the best medication for his condition. I think that should be included in the discussion with Denver Health as well. This wasn't, you know, just something that, you know, was being provided by a family member, but rather there was information from a treating psychiatrist who was available to speak with somebody. Then I have a question for Ms. Robertson. How is your son doing now? I understand he was transferred to federal custody. I know we're discussing these issues that occurred while he was in the custody of the Denver sheriffs, but how is your son doing now? I think we'd all like to know.
Yep, my son is doing okay. The saga has continued. It's not something I can openly discuss just now, but things got a whole lot worse involving Denver Health. At another facility. This is the only thing I'm going to share, but he was moved to another facility after Denver Detention Center. I spoke to my son an hour after he went to the ICE Center in Aurora. And he said to me, he said, I think things are going to be good now, Mom. They gave me clean clothes and they gave me multiple of them. And they gave me a meal that was edible. And he said, I think I'm going to be okay. And he says, I'm just waiting to see the nurse. I never heard from my son for another 6 days. My son was given the option to either detox from his Suboxone and his other medications in his cell, and they would just watch him and make sure, you know, he didn't die. Or he could sign a form and go to Denver Health and be detoxed there. That was his choice. He went to the hospital, of course, terrified. When I spoke to him after, I think it was 60, I had no idea where he was. No one would tell me where he was. No one would tell us anything. He told me he had 12 puncture marks in his arms from all the different, I guess, drips and things they were putting him on. He can't remember some of his time there because he was drifting in and out. He was transferred back to the Aurora Ice Center. And then he was left in isolation. Well, they watched him because he had such severe withdrawals. That continued on. They gave him some medications to try and help with the withdrawals. But that was it. He's now been moved multiple other times from the Aurora Ice Center to Teller County Jail, to a facility in Las Vegas, and now in the Cimarron prison facility in Oklahoma. It is a federal situation, so he's still waiting. This is his first run-in with the law. He's still waiting on being classified. So all they keep doing is moving him from one facility, private facility, I have to state, to another. Every time he gets moved, there's different protocols. The only medication my son gets now is a depression med, a substitute for the one that he was on. The facility he is in now actually does MAT treatment, but my son doesn't even want any other medications because he couldn't bear to go through the withdrawal he's gone through. I don't understand what you guys are all doing. I don't understand this. This seems cruel, unnecessary. And why the federal government can't just classify someone. It's not like he's this big criminal, it's a drug charge. It's not so complicated. We're into week 7 now. The only time I know if my son's moved is because I don't get a daily call from him. We make sure there's always money on his account. If I don't get that call, I know I need to call that facility and find out if he's been moved again. I understand my son gave up his freedom for what he did, and he's paying that price. My son just wants to get, as he now calls it, to his prison so he can know what his daily routine looks like. Maybe start doing some further education, having some kind of normality in his day, and for us as a family to possibly be able to see him at some point, other than a phone call. I think there's so much to be done for all of these systems where we're incarcerating people. And it's terrifying as a mother to have zero control. I just have to watch and keep maintaining my contact with him in the hope that he survives. I'm sorry for sharing so much, I probably shouldn't. But we need change. We need diversion programs, not only at state levels, we need them at a federal level. We're incarcerating people beyond belief. My son is a victim of the opioid epidemic. He was involved in a car accident in 2017 and was overprescribed Oxy. That was in the February. In the September, he came to me to tell me, I've got a problem, Mum. I can't stop doing these. The doctor told me I'm addicted and told me not to come back. My son took to the streets and was buying Oxy, which then turned to heroin. When he came and told me this, Sheriff Diggins, I didn't even understand, what do you mean you're doing heroin? I didn't even understand what was going on. And I did the same old thing that I've always done. I have 3 children, 3 adult children. I told him, just come back home. I'll help you. Your dad and I are here. We'll help you. We'll get through this. You just have to stop doing these drugs. And we tried to quickly educate ourselves. Within a month, I knew there's no way I could help him. We were so far down the rabbit hole. So that's when we started his journey through recovery. And we took him to a recovery center in California. It was the best one we could find. And we felt being gone from Denver and all the triggers and all his using buddies and everything else he had now, been involved in was the right thing to do. Unfortunately, my son, what brought it to the head was my son received a DWI because he had gone out looking for drugs. He tried to come home. He couldn't quite make it home. So he parked in a King Soopers parking lot and went to sleep. And someone reported it obviously to the police. So he got a DWI for that. When we sent him to California, he was doing really, really good, but probation, well, it was interpacked, got wind that he was in California doing rehab. So they told him he had to come back or they would send a warrant out for his arrest. So he was doing really good and progressing through all the programs, but he had to come back to Denver. And that just started the whole cycle of wash, rinse, repeat, where he would catch up with using buddies. Our drug dealers would find him. We'd get him into rehab, we'd get him sober, we'd go through another program, and he was just a chronic relapser. And it just never ended. And then we did something completely different. And we ended up reaching out and got an amazing team of doctors. We didn't handpick them. They came to us by accident because my son was kicked off our medical insurance and was now with Medicaid. And we found an amazing psychologist. She started EMDR treatment with my son, and that was the turning point for him. He was now able to start and work on all of his childhood traumas, everything that had happened to him, because as we discovered, a family member had molested my son at the age of 4. And this all came out in the treatment. And we were able to start and deal with all the things that had really been a problem and why he was so sensitive. So when he was prescribed oxy, it had a whole different effect in his brain. He couldn't stop. So that's what we were doing until the unfortunate incident where he relapsed, bought some drugs from a drug dealer, sold some to some friends. They had all club money together. And unfortunately, one of his friends passed away. So my son was charged with it was his fault because he sold him some of the pills. And that's why we are where we are today. Sheriff Diggins is beyond painful. And through all of this, and this has gone on for years, all my son has done is go and work on his recovery. And I am proud to say he is almost 18 months sober. And it is because of the psych doctor who prescribed him the combination of medications that had the fortitude to realize she needed to do genetic testing and know what it was that would work for him. And for his psychiatrist, for the psychologist to do the EMDR, and for his general practitioner to keep him on Suboxone so he could get time sober and let his brain recover. So today, Sheriff Diggins, my son is doing okay. He's sober. He's found his spiritual connection. He was so excited to tell me yesterday that one of the other inmates gave him a Bible and gave him another book that's kind of a quick way to start and, find different things in the Bible to help him. So again, I shouldn't have shared all this. And I'm sorry. But this is where we are today. And I just feel there's so much, we could do so much better for people out there. People shouldn't have to die from overdoses or fentanyl-laced drugs, but that is what we're dealing with. To make someone like my son responsible for another drug addict's behavior, I don't think is right. Should my son have bought drugs? No. Should he have sold drugs to one of his friends? No. But he wasn't even with his friend. No one knows what he actually did. But here we are.
Mr. Robertson, thank you. So, oh, go ahead, Sheriff.
Mrs. Robertson, please don't feel guilty or feel like you need to apologize for sharing. I'm sure many of us on this call can relate to you. I'll share my personal story. I'm the son of a formerly incarcerated person who dealt with addiction and has dealt with addiction for all of my life. And I know how it feels to have someone in custody personally, which is why I know that it is my calling from God to do the work that I do and to help those that are in our custody. And in fact, I know that, as it says in the book of Esther, that I was put in this position for a time like this, for a time such as this. And I will assure you that we will work every day to make our part of the system better than the folks that are on this call who are part of the Citizens Oversight Board. Not that I'm speaking for them, but I know that their mission is the same, to make the system better as it is for Dr. Johnson, Greg Crittenden, and everyone else. We want to help everyone to get to the place where your son is today. So we thank you for sharing. We commit ourselves to getting better and to helping folks like your son that are going through our system to hopefully break the addiction that they have and to get the help and treatment that they need so that they can get back to their families that love them as well.
Thank you, Sheriff Diggins. It's our mission too, and that's why I've said I want to be involved. It's my calling, it's my family's calling now too. The systems need to be better. We can make them better. We just don't need to incarcerate every single person. We need diversion programs. We just need to understand as a community, we need to understand and stop pointing fingers at everyone else for things that we do wrong.
Agreed, absolutely agree.
Well, thank you for your incredible story and what a remarkable commitment to your son and to supporting him through a very challenging journey. Thank you for sharing that with the board and the public in general in this forum, and our best wishes to him in his journey and you on that path as well.
I appreciate it.
I think that's all of the material and discussion that we have for this session. Perhaps we can adjourn to a quick executive session. And Sheriff and Dr. Johnson, thank you so much for your time today. Really appreciate you coming to the meeting.
Thank you all.
Thank you.
Thank you.